Hello everyone, I am Dr. Roshni Roy and today I am going to talk about types of preventions and misfortunes that come with excessive prevention. So there are primarily four types of preventions: primordial prevention, primary prevention, secondary and tertiary prevention. There is another type of prevention that is called quaternary prevention, which is very lethal and which is not medically advised by any professional. Okay, and I'm going to give you example about this kind of lethal quaternary prevention in this video. जैसे कि लेट मी इलाबोरेट, हमारी फास्टिंग ग्लूकोज की डायबिटिक रेंज की काट ऑफ शुरू होता है मोर देन इक्वल टू 126 मिलीग्राम पर डेसीलीटर. Okay, now most diagnostic centers to enforce more medications, or they are connected with other medicine companies, they write it around 110 109, which is pre-diabetic range. People whose fasting blood sugar is 110 or 105 or less than 126, they do not need anti-diabetic medications like metformin or anything. They just need lifestyle modification, I mean less carbohydrate food intake and some physical activity, reducing abdominal obesity. That will work wonders. But with the collaboration of other medicine companies to increase their labh, they do that. Now I have came across many of these kind of reports. Today I got one report which I will attach here somewhere, where it's even oats. Here the fasting blood glucose is 142 mg per dl, but the postprandial blood glucose, I mean खाने की 2 घंटे बाद की blood glucose level is 108 mg per dl. I mean, can you see, it's impossible if fasting glucose to be more than postprandial in maximum cases. If you do not have pancreatic cancer or glucagonoma or other hormonal disbalances, which is very unlikely. Okay, and so either they have mismatched these two values, either the FBS is 108 and PPBS is 142, which is again within normal limit, or they have miscalculated it altogether. Now if you see the fasting blood glucose, if is 142, then it's diabetic range above 126, then that patient needs medication. But seeing the PPBS, it's very confusing for doctors to understand if the reports are at all correct or not, because we don't want to give medicines to the people who don't need it. And here also the reference limit is also kind of garbadi, disturbing. That is FBS is 70 to 110. 70 fasting blood glucose होना मतलब the person is hypoglycemic. Normal people का भी 90 या फिर 95 होता है mostly, या फिर within 80. Okay, so there is also झोल in the normal referral range. And see, they have given the referral limit of the PPBS from 80 to 140. I mean, it's hilarious that how they are messing around with the cutoff values just to sell more medicines to totally physically fine and healthy people. So that's what I wanted to talk about. So I would prefer to get your tests done from the hospital itself or some reliable diagnostic centers who do not mess around with the normal cutoff limits so much, or you will be just getting misdiagnosed and getting unnecessary medicines inside your system which you clearly do not need. Okay, so have a nice day. Bye bye.